The hospital, a sanctuary where science meets sickness, where compassion meets vulnerability. But what if the very people sworn to protect us were the ones we should fear the most? From doctors who poisoned for pleasure to those who profited from lies, these are the chilling stories of the doctors of death. Michael Swango looked like the perfect doctor. A decorated Marine, charming, intelligent, destined for greatness. But while his classmates filled notebooks with medical diagrams, Swango filled his with gruesome accounts of disasters, death, and poison. By 1983, during his internship at Ohio State, patients began collapsing without warning. Nurses noticed a disturbing pattern. These emergencies always seemed to happen when Swango was on duty. One nurse even caught him injecting something into an IV moments before a woman nearly died. Even after serving prison time for poisoning coworkers with arsenic-laced donuts, Swango reinvented himself. With forged documents and lies, he worked in hospitals across America, and even Zimbabwe, where patients died in shocking numbers. Locals called him Dr. Death. Finally, in 1997, the FBI caught him. In 2000, he confessed to multiple murders. Today, he sits inside the notorious ADX Florence Supermax prison, a chilling reminder of what happens when a healer turns predator. In England, Harold Shipman was more than a doctor. He was a trusted family physician, caring, dependable, beloved by his community. But behind his kindly smile was one of the deadliest serial killers in history. His victims? Mostly elderly women. His method? A fatal injection of diamorphine, medical heroin. After their death, he forged records, blaming heart attacks or strokes. Over 24 years, Shipman killed at least 218 patients, possibly over 225. What finally exposed him wasn't brilliant detective work, but greed. His last victim's will left her fortune to Shipman, a sloppy forgery that unraveled decades of deception. Convicted in 2000, Shipman later hanged himself in prison. He never confessed, never apologized, leaving behind only chilling silence. Detroit, Michigan. Dr. Fareed Fata wasn't killing for thrill, but for profit. A cancer specialist with 7 clinics, he was respected, admired, even called a miracle worker. But his empire was built on lies. Fata told healthy patients they had cancer. Then he put them through years of unnecessary chemotherapy, poisoning their bodies, stealing their health, and billing insurance for millions. It took a brave office manager, George Karadsheh, to blow the whistle. In 2015, Fata was sentenced to 45 years in prison. His crime wasn't just fraud, it was systematic torture of the innocent. Philadelphia. Dr. Kermit Gosnell presented himself as a doctor for the poor, but his clinic was described by investigators as a house of horrors. Blood-stained floors, broken equipment, jars filled with baby body parts. He performed illegal late-term abortions. When babies were born alive, witnesses say he performed snippings, severing spinal cords with scissors, hundreds of times. His staff? Untrained, unlicensed, even teenagers. Patients suffered infections, overdoses. Some never left alive. In 2013, Gosnell was sentenced to life in prison. His clinic was demolished, but his crimes remain one of the darkest chapters in U.S. medical history. Utah. Dr. Martin McNeil looked like the perfect husband and father. A doctor, a lawyer, a pillar of his Mormon community. But he lived a double life of affairs and lies. His wife, Michelle, became an obstacle he wanted to erase. McNeil convinced Michelle to get cosmetic surgery. Afterwards, he carefully fed her a deadly mix of drugs, disguising her murder as a medical complication. But his children grew suspicious, and their pursuit of justice exposed him. In 2013, McNeil was convicted of murder. His motive? To be free with his mistress, without losing money or reputation. Michael Swango, Harold Shipman, Fareed Fada, Kermit Gosnell, Martin McNeil. Each wore the white coat, each swore to heal, and each used that power to destroy. Their stories are a chilling reminder that sometimes the monsters we fear most aren't in dark alleys. They're standing right beside our hospital beds.